Hi, everyone. This is Heather Hodges. I'm an organizational psychologist. Welcome to my show. This is the place where we say I'm in to creativity, bold thinking, transformational growth, and meaningful conversations. Today, I'm joined by Donya Winters, a registered nurse, legal nurse consultant, and fierce advocate for healthcare reform. Donya spent more than a decade at the bedside, and when COVID hit, she was on the front lines in a small town hospital caring for patients in the most extreme conditions. And now, through her consulting work, her upcoming book, The Virus, and her own story, Donya is speaking out about the hidden cost of the pandemic and what needs to change if we want to support the people who care for us. Donya, welcome to the show, and thank you so much for sharing your story and your insights with us today.
Oh, thank you. When you ask me, I'm not just in, I am all in. So I'm very excited to be here.
Oh, I love it. Well, thanks for saying I'm all in to coming on and sharing your story and your insights with us. And, you know, on this podcast, we talk to a lot of leaders, but my heart is on the front lines with the caregivers and especially the nurses who just do the hard work day in and day out at the bedside. And so I'm so grateful for you for coming on and sharing what you have to say about what's going on.
It's a little daunting. Don't mind telling you.
All right, you've been very open about the sense that healthcare professionals were abandoned during COVID. Can you share what that looked like from your perspective and also what the long-term impact has been on nurses and other frontline clinicians?
Well, I'm really glad you asked that question. Yeah, it's something I feel super passionate about. What it looked like at first, I think everybody was so worn out and so traumatized that at first we just kind of wanted to move on. And it ended as quickly as it started, which was very strange. I wasn't sure that was just my experience. So I actually did some studying and it did. It closed as quickly as it opened. So we were so grateful that we just all kind of wanted to move on right away. But, you know, like the book says, your body keeps score. So even if you're not talking about it or dealing with it, things are happening, right? And since we all moved on, the population had COVID fatigue. And I don't think you can have war fatigue if you didn't fight in the war. But so the population just kind of moved on too. Everybody was tired of it, being isolated. So everybody just moved on. And I was okay for a while until I wasn't. I had a triggering episode at the hospital and realized I needed some help. It totally took me by surprise. It was a very innocuous thing I was doing. My body started to shake. I started to sweat. I realized I needed to get some help. So I did. And then it took a couple of years before I could write the book because for a long time I couldn't even talk about some of the things without crying. So once I started writing the book, I really couldn't get other nurses to talk to me, and I still can't. And that speaks to us being left behind as well and how awful the stories are. But when I was writing the book, I wanted to see how nurses were coping during that time, because I know there had to be like affairs, drug abuse, drinking abuse, anything to feel alive during that time. So I know people went left. And so suicides, I wanted to see all of it. There is nothing out there. There is nothing. Not a single longitudinal study has been done since the second wave of the pandemic in 2022. Nobody has asked us how we are. Nobody has studied the long PTSD, moral injury effects. I had to put the book away for a couple of months because that alone just enraged me and hurt me deeply because I was just in this little town hospital. I was not in New York City. So for as much as I'm affected, I know there are people out there, healthcare providers out there who took their own lives over the pandemic because we felt so helpless. But there's nowhere to look that up because those studies don't exist. And that hurts my heart and makes me so angry. And that's just another reason why we feel left behind. Nobody's asking how we are. And you'd think 5 years later we'd be over it, but actually we're just kind of now settling into the effects that had on us and the little things that trigger us that we can't figure out what's going on. And that's what's going on, but nobody's asking.
Donya, I don't even know how to ask the questions that need to be asked to help even understand and uncover what you and other clinicians experience and are still experiencing. It does sound like PTSD.
Yes. And there was a ton of moral injury in there too, but that's kind of just part of the job. Like nursing comes with moral injury daily anyway, as does being a police officer, a veteran, an attorney. But this was on a different level. We were making decisions we should never have to make, like who gets to live and who gets to die, because we only have one respirator, right? So that's moral injury of a whole other level. And those are things that we have to live with now. But I am so surprised that the AMA or the ANA didn't grant some funding for some studies. I think it would have revealed a lot of information that would have been so helpful in case this happens again. So now I feel like if this happens again, it's going to happen exactly the same way. I don't think anything would be different at all. And I think we should be ashamed of that.
Unpack moral injury for us. I think I know what you mean, but it's beyond burnout. But what is moral injury?
Burnout is when you're like stretched to the limit day after day after day after day, and you just can't take it anymore. And that was already sending nurses away in droves as it is. Moral injury is really different. Moral injury is when you are forced to do something that goes against your own moral values. Like I said, police officers have to deal with that all the time. Every time they have to pull out their weapon, nobody goes to be a cop to go killing people, but sometimes hard choices have to be made. And we had to make a lot of those decisions during COVID because resources were so scarce. And especially the ICU nurses and the respiratory therapists, I don't know how they did it because they were the ones making those decisions several times a day. You've got 2 or 3 patients that are on their way out the door and you've got 1 respirator. So how do you decide who gets that? Because you're basically signing the death certificate for the other 2. That's moral injury. Those are the decisions you have to live with. You know, I had to go get a respiratory. It wasn't a respiratory machine. It was just below 1. And I had to run down to ICU to get it. And I felt terrible. I took the last one they had, and I knew what that meant for them. And ended up the patient who got it got sent to the ICU and died before the next morning anyway. And he had walked in on his own 2 feet that morning. Those kinds of things. Just having to face decisions and face situations that go against your own moral code. That's different than PTSD. That's not necessarily an event. It's an ongoing situation where you're having to make decisions that go against yourself. And then later having to live with those.
Yeah.
And, you know, you do the best you can, and you have to remind yourself that. And I want all the healthcare providers out there that are dealing with this to remember we didn't have any guidance. We didn't know what we were doing for the most part. We were just doing the best we could do. And if we can make some of those decisions differently now, knowing what we know, I know we would. But you can only make decisions based on the information that you have at the time. But for as broken as I was, for as long as I was broken, I know that there are other healthcare providers out there who are really suffering, really hurting, and don't know what to do with that.
Yeah. You are a prominent voice on social media. That's where you and I met. We met on LinkedIn and became friends, and have had these kinds of conversations before. I'm curious, what are you hearing from other clinicians, other frontline providers?
Even though I put out there all the time, I'm here. We were wronged. We were left behind. I still have scars. I know you do too. I've sent out an anonymous survey like 3 different times on different platforms. Nobody's responding. They don't have to give me their name or anything, the hospital they worked at, but it's just questions like, what was the worst moral injury you had? And then I explain what that is and what are some of the things you can't unsee and what are some of the things that changed you forever, not necessarily for good, but forever. Nobody is responding.
How do you explain that?
I don't know if they're afraid. Like there were a couple of stories, one that was so injurious to me that I couldn't stop talking about it. And I still can't stop talking about it. But that's me. That's not everybody else. And there might be a lot, honestly, that they can't remember too. I think we all have some blank spots. And I'll expand on this because this just happened to me. I thought I was all done with all of that. But I recently, when the weather was still a little cooler, went up to visit my family. They live in Minnesota. And I had this pair of pajamas, and my mom said something about them looking cute. And I said, I can't remember where I got them. They just kind of showed up in my drawer one day. And they're winter pajamas, so I don't get to wear them very often here. And she said, well, you got them from your sister. And I said, what? And she said, for Christmas, in 2020. And I said, what? And she said, yeah, we all did Christmas together on Zoom and we all wore matching pajamas. It's gone. No recollection of getting the pajamas, no recollection of the Zoom call. Apparently we did gift exchanges and everything. I have no memory of that.
Wow.
Then she said, she looked like I slapped her. And she said, I can tell by your face, you genuinely don't know what I'm talking about. And then she came out and handed me a mug. And she said, do you remember this? And it looked exactly like something I would make. It said coffee time with Nan. They call me Nani. Coffee time with Nan. And it had me and my mom and my dad on the cup. And I said, that's really cute, but no, I don't recognize that. And she said, we had coffee with you every Monday during the entire pandemic. You made us this mug. We all had mugs.
Wow.
No. And I just started to cry.
Yeah.
Because I thought all of that was over for me. And here are these wonderful conversations that probably really glued me together a lot of days. I don't remember that we did it at all. So if I'm having those time gaps, and like I said, my experience was comparatively minor to the bigger hospitals, I'm wondering if that's part of it too, or the stories are just too awful to tell, but we have to. We have to. We have to talk about the patients. We have to talk about the effects on our own moral code and our own mental health. And I feel like there are so many providers out there that are just trapped and maybe don't even know it. But it hurts my heart. So.
One of the things I'm wondering about now is when we're talking about moral injury, which, it sounds like if we're looking at this burnout spectrum, like from flourishing to moral injury, like in burnouts in here somewhere.
Burnout and PTSD
are way, way over here. What are some of the signs that, in your research that you have discovered about moral injury? How would somebody realize that or recognize that in someone?
I'm not sure that they would, which is why I think we need to talk about it more. It's just it's been a thing for a long time, since like the 1970s, but always only in reference to veterans. Because let's face it, their moral injury is probably worse than anyone else's. So for a long time, it was just relative to them. It is just now the pandemic kind of pushed it to the forefront, just like the hidden hypoxemia we talked about last time we talked. There's a lot of things that have existed but are being pushed forward now. So I talk about it a lot, and I know everybody on LinkedIn is probably sick to death of me talking about it. And the attorneys are ignoring me because they don't think that they can use it in court, but they absolutely can. Like I couldn't. There's nobody to sue for my moral injury, and there's nobody I should sue for my moral injury. But when you look at, for instance, this made the news, you might have heard about it. These parents lost their son. He was in his 50s, and there was a funeral home that picked him up and a different funeral home that cremated him. So They got the call that his cremains were ready, and they went and picked them up, but they couldn't bring him in the house yet. They were still really grieving. And so they kept it in the car. So the dad went to go someplace like 3 days later and got in the car, and there's this awful smell. And he realized it was coming from the box of the cremains, and he opened it up, and his son's brain was in there. His son's deteriorating brain. That is moral injury that can be used in court.
That's awful.
It's horrible. I mean, I would never want to leave my house again. All the people you think you can value and trust, they never even asked if they could remove his brain, number one, because he was being cremated. Mm-hmm. And number two, to box it in their cremains and not, how do you not know that you're putting a brain in some, yeah.
Oh
so
my gosh.
Happened. So there's moral injury of all types. As you can see, it's everywhere. Mm-hmm. So the people who are exposed to it for a living, that's the route we chose. There's not much we can do about that except for make those conditions as best we can. But then there are moral injuries like that. And we need to start talking about them because it affects us all, not just personally, but as a society. And not talking about it says more about us than talking about it.
Well, I'm curious if what message would you have for other clinicians who may be experiencing this? How do they live through, heal, move past what you've experienced?
I think you've got to get out there and talk to somebody. Like I said, I was really fortunate when that instance happened to me. I realized I need some help, and I went and got it. And I was in therapy for over a year. The first few sessions, I walked in, started crying, cried the whole time, and then left. I couldn't even speak about it. But I eventually could, and it helped. And then I found creative things that I can do. Even though I am not artistically inclined, I am very creatively inclined. So I was able to find some artistic outlets that really helped me like get in the zone and block everything out. It gave me mental rest, mental peace, and meditating too. But I think a lot of them just feel really isolated in how they're feeling and don't realize that we're all feeling that way. I think all of us feel that way to a degree. The nurses that were a generation under me, they didn't seem to be as affected, which is odd because the studies I read said that they were more affected than like Gen X was. But they really were just kind of moved on. But it probably looked like I did too. So I don't know. We don't know because we're not talking.
Yeah, the silence is interesting, isn't it? Like
it is. I can't really figure it out. I can't pinpoint why. Because I'm not a silent person. I never have been. So,
well, is it possible that it's isolated, or you're convinced it's not?
I think the people might feel isolated, especially like, your macho hospitalists. We were watching them just break down. The life just was, every day you saw more life leave their eyes. It was haunting to be a part of and watch. So I know they're carrying this. When you go to school for so long and dedicate your life to helping people, and nothing you do is working for 18 months, nothing you do makes a difference. That weighs on you. You feel absolutely useless and helpless. Like, why aren't we figuring this out? And then with all the misinformation that was on all the time, and I can't even get on that soapbox or I'll get really angry. That didn't help things either. We were really being dismissed, even as it was happening. It was all being very downplayed. So that didn't happen either. So I think people figure, why should I talk about it if nobody's listening? And if it's just another COVID nurse that wants to hear my stories, what good is that going to do? I mean, I can't personally change anything. Maybe I could get me in front of Congress. We'll see. I have a lot to say. But, and one person can't change anything. That's why I want more of these nurses to start talking about it. Because it's the 5-year anniversary. If we haven't done the studies before now, then we need, it's not too late. We still have things to say. We still have stuff that we're carrying. And it would go a long way, I think, to feeling like we mattered.
Mm-hmm. I've recently done some research, and I did interview clinicians, administrative personnel, and then leaders in healthcare. And to a person, every single one of the clinicians mentioned COVID and mentioned the pandemic. It still looms large in their minds as well, even though a lot of the admin professionals and the leaders, they didn't mention it, I don't think, at all, but every single clinician did. And I find that fascinating. The rest of the world, COVID fatigue, we're ready to move on, let's go. The lockdown's over, we've got places to go, things to do, people to see. COVID, that's in the rearview mirror.
Yeah. And even at the time, the leaders were really downplaying it. I remember I got sent home in the middle of a shift because I was coughing, and it was really wet that day and cold. So it felt like it was just asthma, but they're like, no, you need to go get tested. So my rapid came back negative, but the next day they called me in the middle of my shift and said my PCR came back and I was positive. And I immediately started bawling because I had been around patients all day. I had been around other nurses all day. I felt like Typhoid Mary just on the spot, even though I felt fine then. So I went to tell my house supervisor that, and I was crying, and she made fun of me for crying. I'm like, I don't even know. I can't tell you who I interacted with today. I was just so devastated that I could have potentially infected others. But since she wasn't at bedside, she didn't know what that meant. She didn't know what possibly infecting another person might look like to them. I knew because I was living it every shift. But yeah, she was very belittling and dismissive. And then I was out for 3 weeks because COVID. So, but yeah, so I think the leaders were really far removed from the pain of the moment in every shift. They didn't have to see it. And there's really no way to relay it if you're not experiencing it. It's really difficult.
Mm-hmm. Well, what would you like to see change in healthcare culture, both, in terms of how we support our clinicians, but also how we create space to talk honestly about these tough realities you're telling us about?
There's so much I'd like to see change. Nobody really wants to tackle it because it's this big Titanic, right? And it's going to take a lot to turn it around. But I just think we should let the Titanic sink like it did and just start building a new ship. And I think the first thing we need to do, which will probably never happen, at least in my lifetime, is demonetize healthcare. Healthcare has to stop being a business. Because all those leaders were worried about were nurse to patient ratios, losing the surgeries they lost for 18 months, which is every hospital's moneymaker. Everybody was so concerned about numbers. Nobody was paying attention to the damage being done to the patients and those treating the patients. And as long as healthcare stays monetized, it's always going to be that way because the bottom line is always going to be a number or a monetary value. It's never going to be a person. It would have been great if they would have thought ahead or asked some questions or even just looked at our faces. They would have known what was happening, Listening to the wildly inappropriate conversations we were having in the nurses' station let off steam. It would have been pretty clear, pretty fast. And then just have somebody on site if we needed to talk on days that we weren't working there wouldn't have been time during a shift, but just somewhere to let off some of that helplessness. Somebody to tell us that we were doing the best we could, that we weren't failing because we felt like we were failing all the time. I remember one time, this was at the beginning, way before the vaccine, but before remdesivir, before any of that. And all we were doing was giving zinc and thiamine like 3 times a day. And, it does boost immunity, but we all knew it wasn't doing anything. So I was in the med room and I saw that come up on the schedule and I pulled it and then I threw it across the room and sat on the floor and just started to sob because I wasn't doing anything. I was going through motions, but it wasn't making a difference. So everything needs to change. Nurse-patient ratios need to change. The monetization of healthcare needs to change. We could cut probably 2/3 of administration in hospitals to fund healthcare. It's so top heavy, and it's because of all the numbers and all the money. And yeah, that's another soapbox. That's the whole last third of my book, and I've got some really wild ideas, some stuff that's really out there, but somebody has to start thinking outside the box. And I am not an economist. I have no business even really talking about it. I'm not an expert really in anything. But we can't say nothing can be done, because that's just not true.
Yeah. I'm also wondering, right now we're still, we had a shortage of nurses, for example, before the pandemic. And the pandemic has obviously exacerbated that issue. Like the retention is really challenging. Staffing, every healthcare organization I speak to has staffing challenges. From your perspective, is this part of it?
I think it has a lot to do with it. Yeah. And I'll tell you something. We would not have survived without the travel nurses that helped us, but they were making $100 an hour and we were making 28. That was a huge betrayal in every hospital. That the ones that were choosing to stay and not travel somewhere else, we all could have left our local hospitals and traveled for COVID somewhere else and made 4 times as much as we were making. But we were choosing to stay home and felt like we were getting punished for that. And that felt like a huge betrayal to the entire profession. I know that. I've spoken to nurses. Home nurses that felt that way. And I made some wonderful friends that were travel nurses, and they really had my back, and I'll never forget them. And I don't resent them. I just resent the way everything was handled. And then before everything was completely over, they sent them all home without hiring real staff to take their place. So there were just betrayals on every level. During
so
COVID.
You were left with more work.
We were left with more work. Yes.
Yeah.
More work, way less money than they were making. And they weren't even taking into consideration that just because the peak of COVID was over didn't mean that things were over for us. We still had COVID people trickling in. And at the same time, we're trying to transition back to our normal unit. And I was in a step down unit, so it wasn't quite critical care, but I should not be taking 6 patients. I should be taking 4 or 5 at the most. And so then that got unsafe too. And then I got an on the job injury that was severe and had to go into emergency spinal surgery, and they wouldn't cover any of that. They wouldn't cover that. They wouldn't cover my time off. So there's a lot of systemic betrayals that happen, even though we're choosing to stay for the patients. But not only are we not getting rewarded for that, it feels like sometimes it's very punitive.
Well, for anyone listening who is struggling to find their voice or to heal from these experiences, where do you suggest they begin?
I would absolutely reach out to me or any other person that's been on the front line, because they're going to understand, and you've got to get some of that off your chest. But I absolutely suggest professional help, because once you start peeling the layers back, it gets a lot more complicated, because then even stuff about your upbringing or the kind of person you are or the things that you believe, that all got knotted in there, and you have to unknot it one at a time so you can put everything in its proper perspective. Oh, this is old garbage. This doesn't even have to do with COVID. So I can just lay that down and let that go. But yes, this absolutely has to do with COVID and how it made me feel as a professional, which was completely different even than as a person. But they both have to be untangled. And it's a lot of work. And I don't think anybody should try to do that alone, but I think everybody should try to do it.
Wow. Well, Percy's knocking at the door over here, but before I open the door and let Percy in, can you tell us just a little bit more about your book, The Virus? When is it coming out? What does it cover? What can we expect?
I don't know when it's coming out yet because the whole section I had planned on how moral distress lived itself out in these nurses that I don't have information for. I now have to find information to put in that spot, which I haven't done yet. But the front third is done and the last third is done. I just have a hole now in the middle where all of that was supposed to go. Yeah. It's about my experience personally in the hospital, some of the horrible things and decisions some of our hospitals made. And then just about what it was like in general for people, because I've got a lot of studies on that during the time. And then I have a lot of government soapbox stuff on the last third about how things can change and what we need to do in order to make that happen. Yeah. So I don't know when it's coming because it's got a gap right now. But I'm working on it.
If someone who's listening to this podcast today thinks they might have a story for you, is it okay if they reach out to you?
Absolutely. I would love that. Not only for my book, but for them. Okay. Just to be able to unload this to somebody who totally understands. There's no story I would find more abhorrent than some of my own, so I'm wide open for that. Absolutely.
All right. Fantastic. And in the episode notes, we will put your contact information so someone can reach out to you.
I appreciate that so much. Yeah. I would love it if some people would reach out. I really would, because it's a hard road to go down by yourself.
Well, thank you for sharing all of that with us. And before I let you go, I told you, about Percy. He's persistent. All right, Percy, come on in. What questions do you have for Donya?
Uh-oh. I'm ready.
Here we go. All right. Percy's first question comes from a previous guest, Tom Maxwell. And the question is, how do you coach hustle? How can you teach hustle?
Oh, that's a great question. I'm not sure that hustle can be taught. I would have to think on that. I mean, I think you're either one of those driven people or you're not. Can you teach drive? Because hustle kind of comes from drive, right? Can you teach drive? I don't know. That is a great question.
So you think that it is innate? Like you've either got the drive, you've got the hustle, or maybe not.
Or maybe not. And you don't have to. You can still get things done without hustle. Hustle's not all positive. Hustle kind of takes away sometimes from your downtime, from family time. It's not always about hustle. Yeah. But some of us are very driven that way.
Yeah. But I see what you're saying, though, that it could be, two sides of the same coin. That exactly. It can get you where you're going, but take away from something as well.
Yes. Exactly.
Wow. All right. Well, Percy's second question is, what question would you like to ask a future guest?
I would like to ask a future guest if there was one thing you could either add to or take away from the world, what would it be?
Add to or take away from the world, what would it be?
Thing.
Okay. Yeah. I have a few thoughts.
Yeah. Add to or take away from.
Wow. Yeah. Okay, great. That's going to be a fun conversation. Thank you for that. And Donya, thank you for sharing all of your insights and your stories and just your passion with us today. Where can our listeners find you?
You can find me on LinkedIn. I'm fortunate enough to have a really unusual first name. It's D like David, Onya, Winters. I'm on LinkedIn. I'm on Instagram. I'm on Facebook. wintersrnconsulting.com. That about covers it, I think.
Okay, great. And we will list all of those in the episode notes. So thank you so much for being here today.
Oh, thank you. I was so excited when you asked me. Thank you.
You bet. And thank you to our listeners for joining us in this conversation. And if you enjoyed today's episode, don't forget to subscribe and share it with somebody who could use a dose of inspiration and creativity. And please leave us a review. I read every single one. So until next time, keep saying I'm in to creativity, bold thinking, transformational growth, and meaningful conversations. May you be wildly creative in your life and leadership. I'll see you soon.